Struggling with a stuffy nose, sneezing, or that scratchy throat? Find out if it's just a cold or something more serious like a respiratory infection. Definition: inflammation and irritation of nasal mucous membranes. Impact: affects quality of life, contributing to sinus, ear, sleep issues, and learning disorders. Often coexists with asthma. Prevalence: affects 10 to 30% of the global population annually. Viral rhinitis, e.g., the common cold, impacts 1 billion people yearly. Types of rhinitis. 1. Allergic rhinitis. Caused by allergens like pollen, dust, or pet dander. Symptoms: sneezing, nasal congestion, itchy nose, and watery eyes. Types: seasonal, hay fever, or perennial year-round. 2. Non-allergic rhinitis. Triggered by irritants like smoke, pollution, or strong odors. Symptoms: nasal congestion, runny nose, and postnasal drip. No involvement of the immune system. 3. Acute rhinitis. Short-term inflammation, often due to viral infections, like the common cold. Symptoms resolve within days to a few weeks. 4. Chronic rhinitis. Long-lasting, over 12 weeks. May result from allergies, structural issues, or persistent irritants. Pathophysiology of rhinitis. Causes: environmental factors, temperature, humidity changes, odors, and infections. Allergens, foods, e.g., peanuts, milk, medications, e.g., penicillin, aspirin, and airborne particles. Medications: drug-induced rhinitis from AC inhibitors, beta blockers, statins, antidepressants, and antipsychotics. Foreign bodies, present in the nasal cavity. Mechanism: exposure to triggers leads to inflammation of nasal mucosa. In allergic rhinitis, immune response involves histamine release. Complications: leads to congestion, sneezing, nasal discharge, and other respiratory issues. Clinical manifestations of rhinitis. Symptoms: rhinorrhea, runny nose. Nasal congestion and discharge, purulent in bacterial rhinitis. Sneezing. Itching, nose, mouth, throat, eyes, and ears. Headache, common with rhinosinusitis. Medical management of rhinitis. Diagnosis: based on patient history and physical examination. Identify allergens in the home, workplace, or environment. Treatment based on cause. Viral rhinitis. Symptomatic relief through medications. Allergic rhinitis. Allergy testing, desensitization immunizations, corticosteroids if needed. Bacterial infection. Use of antimicrobial agents. 3. Special cases. Nasal septal deformities or polyps. Referral to an ENT specialist. Pharmacologic therapy for rhinitis. Symptom relief. Medications target sneezing, pruritus, rhinorrhea, and nasal congestion. Common medications. Antihistamines. Most frequently used for sneezing, itching, and runny nose, e.g., brompheniramine/pseudoephedrine Dimetapp. Corticosteroid nasal sprays for severe nasal congestion. Mast cell stabilizers. Cromolyn, nasal crom, inhibits histamine release. Oral decongestants for nasal obstruction. Other therapies. Saline nasal spray, mild decongestant, and mucus liquefier. Intranasal ipratropium. Atrovent 2 sprays in each nostril 2 to 3 times daily for runny nose. Ophthalmic agents. Cromolyn solution for percent for eye irritation, itching, and redness. Advanced treatments. Leukotriene modifiers. Montelukast, Singulair, Zafirlukast, Accolate, Ziliton, Zyflo. Immunoglobulin E modifiers. Omalizumab, Xolair. Immunomodulatory medications. Used in severe cases and overlap with asthma treatment. Medication choice factors. Based on symptoms, side effects, drug interactions, adherence, and cost. Nursing management for rhinitis. Educating patients about self-care. Avoiding allergens and irritants. Reduce exposure to dust, molds, animals, fumes, sprays, and tobacco smoke. Medication education. Teach proper use of medications and caution with OTC drugs to prevent interactions. Instruct patients to read drug labels carefully. Environmental control. Encourage maintaining a clean and allergen-free home and workplace. Use saline sprays to soothe mucous membranes and remove irritants. Nasal medication administration. Blow the nose before application. Keep the head upright, spray away from the nasal septum, and wait 1 minute before the second spray. Clean the container after use and avoid sharing to prevent contamination. Hand hygiene. Teach proper hand washing to prevent spreading infections, especially to vulnerable groups, young children, older adults, or immunosuppressed individuals. Vaccination. Emphasize the importance of annual influenza vaccination for older adults and high-risk populations.